Good day, everyone. We are student researchers of the Dentistry Department from Central Escolar University, Malolos, Philippines. We are presenting a research entitled The Implications of Constructive Criticism in the Level of Self-Confidence of CEU Clinicians in Doing Clinical Procedures. The authors are Ms. Alizon Apoderado, Ms. Charmaine Jem Cauyao, Ms. Kyla Jan Andrea Malubay, Ms. Christine Joy Reli, and Ms. Mika May Reynoso. Dental education, a challenging field that requires both theoretical and practical skills, has faced significant challenges due to the COVID-19 pandemic. The shift from face to face learning to digital learning has left students with a lack of self confidence in performing dental procedures. The psychological impact of this pandemic on students' mental well being is also significant, as they may experience anxiety and low self confidence due to the shift to live patients. Dental students often experience high perceived stress levels due to the demanding nature of their training, clinical environments, personality traits, relationship issues, and academic burden. This can lead to impaired performance and self confidence. The Tress article on constructive criticism highlights its benefits, such as allowing students to evaluate their own performance, understand their past, and receive advice for improvement. Positive criticisms can boost confidence and encourage growth. However, some students may find negative feedback detrimental to their confidence, especially those with lower self esteem. Therefore, feedback should be perceived as constructive and forward moving to be effective.
Significance of the study. This study is conducted to benefit the following. First, students. Fifth-year students will have self-awareness on the implication of constructive criticism, not only on their work, but also on their level of self-confidence when doing clinical procedures. It will also serve a guide on how they should perceive constructive criticism during the procedure. Second, professors. Professors and clinical instructors play an important role in giving feedback and criticism to the students. Through this study, they will become informed and aware on how constructive criticism may affect the students' level of self-confidence during clinical procedures. Through the help of this study, they may be able to adjust their teaching style, which can be more favorable to the students. Third, future researchers. The data will be produced in this study is a beneficial reference if the future researchers will be searching for similar studies. Since there are only few similar studies, they may uncover some other areas which previous researchers have not yet explored. Methodology. The study utilized a correlational research design. The study was conducted via Google Forms, and the participants included dental clinicians from Central Escolar University Malolos, Makati, and Manila during second semester of school year 2022 and 2023. There are 40 dentistry clinician students in Malolos campus, 82 in Makati, and 426 in Manila that can be included in the study. The data obtained from the respondents was evaluated to determine the clinician's degree of confidence of each campus. To get the sample, the researchers used Rosov sample size calculator. The margin of error in the study is 5% with 90% amount of uncertainty that can be tolerated. The recommended sample size would be 35 dentistry clinician students in Malolos, 64 in Makati, and 166 in Manila campus. With this, each student will have an equal chance of getting included in the study.
Theoretical framework was based on feedback student interaction model made by Lipnevik and others in 2016. It gave an emphasis to feedback as one of several environmental factors that can have a proximal influence on students' competency and general receptivity of feedback. The theory posits that the control and value appraisals students make of achievement situations mediate the influence that feedback and other social factors have on emotions. When students receive constructive criticism, they produce cognitive and affective responses that are often tightly interdependent. Students will inevitably vary on their personality, general cognitive ability, receptivity to feedback, prior knowledge, and motivation. For the conceptual framework, The framework of the study will assess how constructive criticism may influence the self-confidence of the CEU clinicians in performing clinical procedures.
For the results, the data conveys the mean, the standard deviation, and the verbal interpretation of the level of confidence of the students from all CEU campuses. If you look at the results in each clinical procedure, overall, they are interpreted as somewhat confident. Table 13 shows that constructive criticism have a great effect to the dental students of Malolos, as majority of them answered that they strongly agree. While in Manila and Makati, most of them answered agree, this implies that they are only affected by constructive criticism to some degree. Therefore, constructive criticism received by the dental students can have an effect on their clinical performance in doing clinical procedures. Table 18 shows that the computed value is greater than the tabular value. Therefore, the null hypothesis is rejected while the alternative hypothesis is accepted, indicating that there is a significant relationship between self-confidence and constructive criticism.
Conclusion. Based on the findings of the study, there is a significant relationship between self-confidence and constructive criticism of CU dental students from Malolos, Makati, and Manila. Majority of the students agree that their overall confidence level has something to do with the constructive criticism given to them. In this study, we have 3 recommendations. First, for the students to have self-awareness on their level of confidence when doing clinical procedures. It will also serve as a guide on how they should perceive constructive criticisms during the procedures. Second, for professors and clinical instructors to play an important role in giving feedback and criticism to students. Through this study, they will become informed and aware on how constructive criticism may affect their students' level of confidence during clinical procedures. Through the help of the study, they may be able to adjust their teaching styles which can be more favorable to their students. Third, for the future researchers. The data that will be produced in the study is beneficial reference if future researchers will be searching for similar studies. Since there are only few similar studies, they may uncover some other areas which previous researchers have not yet explored.
We would like to give thanks and appreciation for the efforts of Centro Escolar University IERB in reviewing and giving ethical approval in conducting a crucial study, and to our program head, Dr. Shirley S. Wong, for sharing her knowledge and guidance to us. We also extend our gratitude to Mrs. Elizabeth Rosas for helping us. Moreover, we would like to thank the dental clinicians from CEU Malolos, Makati, and Manjola for their cooperation in the time of survey. Also, we would like to thank the organizing committee of the 11th Multidisciplinary Conference on Current Research Trends. Thank you, and may God bless us all.